Welcome to online awareness classes of different diseases and integrated yoga therapy programs. I am Dr. Shashikant. Today we are going to discuss something about epilepsy or fits. It's called as fits, F-I-T-S in common words. There are few children or adults who are suffering from epilepsy, or we also call as a fits. As I mentioned, epilepsy is a group of disorders or diseases in which there is a symptom of recurrent seizure. What I mean is a seizure. Seizure in general means involuntary body movements. Either it may be just an eye movement or hand movement or one side of your body, entire hand and leg movement involuntarily, which happens due to abnormal excessive electrical activity in the brain, which may lead to involuntary change in your body movement or your body function, sensation, awareness, consciousness, and also on your behavior. So most of the people, most of the patients who are suffering from epilepsy, they tend to neglect their own health and just symptomatically take the medicines as and when there is a symptom of fits or seizure. So for this particular reason, we have started an online awareness program on a particular disease of epilepsy, because lifestyle modification is extremely important in managing and controlling this epilepsy disease. So we run through a few details about epilepsy now. As I described, it's a temporary abnormal electrical activity in the brain that causes an involuntary change in a body movement, function, sensation, awareness, consciousness, and your behavior. So that is about a definition. So what are the different causes of epilepsy? We'll run through fast. So they say more than 70% of causes of epilepsy is not known, it's unknown. We also say it as a idiopathic, I-D-I-O-P-A-T-H-I-C. Idiopathic means unknown. We also say cryptogenic. Cryptogenic means cause is not known. So that almost accounts for 70% of total epilepsy disease. And other 30% involves remote and symptomatic causes. We'll just see what are all the different causes, remote and symptomatic causes of epilepsy. Most commonly comprehended cause we say is a genetics. If somebody in a family having a history of epilepsy, their children or grandchildren tend to have the similar epilepsy symptoms in their family. So their genes are susceptible enough to have this disease of epilepsy when your external environment triggers the possibilities of epilepsy. Any history of head trauma, any head injury, your motor vehicle accidents, car accidents, wherein there is a head injury or a fall in which there is a head injury, that can cause a secondary symptoms of epilepsy. Some brain conditions like a stroke, where there is a bleeding inside the brain, that can also cause symptoms of epilepsy. A few rare diseases like neurocysticercosis, a formation of cysts inside the brain of a parasite, that can also cause epileptic attacks. So few infections like hepatitis infection, HIV infection, viral encephalitis, and few other infectious disease can also cause secondary symptoms of epilepsy, because there is something happening triggering those brain cells to cause an involuntary, abnormal, excessive neurological or electrical activity in the brain. So few other conditions like prenatal, when the baby is being delivered out of mother's womb. So prenatal baby injury to the head, bleeding inside the head can also cause seizure. Few rare diseases, developmental diseases of the brain, and some diseases where there is abnormal deposition of some of the chemicals in the body. Those causes can also cause secondary epileptic attacks. In children, there is one entity called as febrile convulsions. When the fever is more, the child having more fever can also induce epileptic attacks. And few other rare causes, we can say inborn errors of metabolism, difficulty or change in the metabolic system where there is abnormal production of some chemical in the body which may go and get deposited in some parts of nerves or brain and can cause epileptic attacks. So these are all very few remote symptomatic known causes of epilepsy. Next we go ahead, how many different types of seizures or epileptic attacks are there? There are two broad classifications. One is a primary generalized seizure where throughout body there will be some or other changes in the form of seizure. You can say partial movement of one side of your eyes to twitching of the muscles, movement or tonicity of the one hand, or involuntary movements of one or entire leg, or if not anything, a simple staring. A person may suddenly become, he can stop and suddenly it become like this, as I demonstrated. So this is a staring attack where at that particular few seconds of the time, patient or a person doesn't realize anything. So there is a loss of consciousness or loss of awareness or loss of the task which he is doing now, and he will stop in that particular moment. In that particular moment of a seizure frequency or a seizure attack. So there are few groups of primary generalized seizures we'll see, and there is one more category, we call it as a minor or a very focal, or we call it as a partial seizures, where only small part of the brain has an abnormal electrical activity which will induce a very focal, very simple, very minor, not noticeable changes. Again, it is divided into two. One is a simple focal seizure where there is a very gentle flickering movement of one part of your body or eyes or muscles or a twitching of your mouth cavity or some abnormal hand movements of only one part of a body, and it's localized only at that point, maybe some involuntary contraction of your fingers. So it is just focal. So part of a brain involved is a localized. So it is not generalized. So that is a focal, simple focal seizure where there is no loss of consciousness. Your consciousness is intact, but there is abnormal movement of some part of your body. Second type is dyscognitive focal seizure, wherein there is a partial, very few seconds of loss of awareness or loss of consciousness of the patients, which also involves a localized seizure along with cognitive dysfunction. So that is a minor form of seizure. We are going ahead with primary generalized seizures. There are different types in that. We call absent seizures, tonic seizures, clonic seizures, myoclonic seizures, atonic seizures, and tonic-clonic seizures. Tonic-clonic seizure is also called as grand mal epilepsy, in which absent seizure, we call it as absent seizure because it is a part of generalized seizure where the person notices few seconds of absenteeism, or the person stops doing things which he is doing right now, and it may have an attack of staring or an attack of very brief loss of awareness or a confusion, which is not exactly related with generalized tonic convulsions. So patient is not aware of that he had a convulsions. So it is not a major one, but it is still, it's a generalized. It is again generalized, but it's absent. Why they call absent? Because there is no fits like movement of the body which patient can be aware, but he can only notice very few seconds of loss of awareness and consciousness. Second is a tonic seizure, in which muscle tone is in a such a way that there is a stiffness of the muscles, group of muscles throughout the body, in which patient may fall because of tonicity, or patient will have some other issues, like if the patient is swimming, so he may suddenly stop swimming because muscles have become tense, the tone of muscles is increased. So that's one variety of primary generalized seizure. These things are few rare seizures. Clonic in the sense, there is a jerky movement of your arms or your leg. So it's like a jerky movement of your arm. So that we call it as a clonic seizure, where there is a jerky movement, abnormal jerky movement of either one part of arm or a half a part of the body, or throughout the entire body, both legs, both hands, or one hand or one leg, or both the legs. Another one we call it as a myoclonic. Myoclonic we call because myo means muscles, clonic means jerk. So there is a simple jerks like a twitching like this. I am demonstrating now like this. So there might be jerk in the person's muscles along with clonicity. So we call it as a myoclonic seizures. Atonic means suddenly the person develops no tone in the muscles. Say for example, I am standing, my muscles are holding me up and it is making me erect and stand. So atonia means suddenly patient will fall onto the ground because there is a complete loss of tone of muscles throughout the body. So we call those seizures as atonic seizures. Last one is a clonic tonic seizure. We also call it as a grand mal epilepsy or a major type of epilepsy. Tonic because muscle tone is increased, muscle stiffness is increased along with jerky movements. So muscles have become very stiff. At the same time there is jerky movement of your body. So that we call it as a tonic clonic seizures. We go in much detail about this in our workshops. When you come to attend our workshops, we go in much detail about this, and we specifically focus on each patient, each person who is coming with these forms of epilepsy or seizures. We focus on each patient and we will categorize. Is it a simple focal or dyscognitive focal seizure, or absent seizure, tonic seizure, clonic seizure, myoclonic seizure, atonic seizure, or tonic clonic seizure? We categorize and then we advise them a specific forms of therapies or treatment which are beyond medicines. So we are not here just to give medicines, but to modify lifestyle changes and integrate yoga in a such a way that there is the reduction of stress in the person and overall health of the person may increase and the number of seizure frequency reduces. now we go ahead with few symptoms and signs of epilepsy. As such, during non-attack phase of epilepsy, there will be absolutely no symptoms at all for any of the patients with epilepsy. But during the epileptic attacks, we say epilepsy attacks. Epileptic attacks, there might be few symptoms like confusion, a staring spell. A staring spell means, say for example, I'm teaching you something and I demonstrate a staring spell. Suddenly while teaching, I'll suddenly stop and look at something as a vacant like this. And then again I'll come back to my consciousness. So that we call it as a staring spell. Suddenly the patient or a person fix his gaze on some point. He is not aware of the point, but still he is into the stage of epileptic attacks. There is an attack of epilepsy, but patient is not aware. So he may, again I will demonstrate, end up in a staring spell. While talking, suddenly he will stare like this. Because I am conscious, I am not exactly into epileptic attacks, but still I am trying to demonstrate epileptic staring spell. That's the one reason which you may laugh, because I am simulating or demonstrating the possibilities of staring in the epileptic attacks. So staring is also a symptom where most of the people may miss it. So that's why I am focusing and insisting on that and demonstrating also. Patient third symptom is patient may have an abnormal jerk in arms and legs, maybe continuous abnormal jerky movements of hand and leg is also another symptom. Loss of awareness or loss of consciousness is another symptom. A psychic symptom or a behavioral change. The person who is having or undergoing epileptic attacks may undergo some behavioral changes. Patient may become aggressive excessively or starts crying, or there may be vomiting sensations or excessive talking frequency, or patient will be in a confusion state and doesn't know what's happening. So those are all few symptoms which I demonstrated or mentioned here. Those are symptoms of epilepsy. I mentioned confusion, a staring spell, uncontrollable jerky movements of arm and legs, loss of awareness, loss of consciousness, a psychic symptoms or behavioral changes in the patient. So all categories or types of seizures may have a varying combination of these basic symptoms. So some may have a profound loss of consciousness with excessive uncontrolled movements of arm and leg, and few people where in absent seizure they may not be having any tonic-clonic seizures, but they just have a staring spell. So depends on types of epilepsy and the condition of the patient and the age of the patient and the medication. If the patient is taking medicines, he or she will be in a controlled state. If they are not on medications, they will not be under control. So we advise you to continue medications properly. So irrespective of cause of, some of our students are laughing because I demonstrated staring spell, because at the moment people can laugh, but when you see an actual person having a staring spell or abnormal gaze of eye and suddenly falls, then you realize that this is one of the symptom of a staring spell, and then you can identify. At the moment you can laugh because you don't know, it looked like a fun, but in a disease, when you identify a disease, when you see a patient, then you identify what exactly is a staring spell. So maybe in few of the video recordings we have of our actual patients having a staring spell that we will demonstrate in our upcoming classes. These are few line diagrams I am showing you. Imagine there is an excessive, abnormal temporary electrical activity in the brain. I am showing it as an abnormal firing here. This will induce, if it is one-sided, localized, it will induce change of reaction of, if it is a left-sided abnormal activity, it induces changes in the right side of the body. So abnormal activities of the eyes, twitching of the eyes, twitching of the face, twitching of the hands, or contraction of the hands, or convulsions of the hands and legs may have, or biting of the tongue, or excessive salivations, difficulty in breathing. So all these symptoms are of irregular, abnormal, temporary electrical firings in the brain. It's demonstrated like this. Just imagine there is a more electricity or a more fire here, or more electrical current here. So it induces, currents have been channelized with the connections which connects to eye, which connect to your arm, which connects to your legs and other parts of your body. So then there will be changes in that particular half of the body. If the same abnormal firing is localized to one part, so there may be only one twitching of the eye area or some part of the brain, very localized. If this excessive firing will become generalized, so throughout the brain, then it will induce in tonic clonic seizure. We say because abnormal electrical activity is throughout your brain, so it induces tonicity of your muscles and also abnormal jerky movements of your hands and other parts of your body. So I make this diagrams because it is not a very technical class where I can say all the details about which nerve, from where it comes, where there is abnormal activity, which are all the different causes, because that will become very technical. Technicality is not important at the moment because this is a patient education program where we are mainly focusing on patients to understand themselves and their disease and treat them effectively with medications, lifestyle modifications and integrated yoga therapy. So this is our motto. Now coming to the treatment part. Most commonly, anti-epileptic medications. It works very well with the patients of epilepsy, depending on which is the cause of epilepsy, or if it is unknown. Most of the time, patients will feel better with the proper medication dosages. On an average, they say you have to take medicine for about 2 to 5 years, usually, till the symptoms reduces and stops. Second and rare treatment option is the surgery. So the part, as I already shown, the part of brain which is causing excessive electrical activity will be removed to stop or reduce epileptic attacks. So that is a rare form of treatment people usually undergo. If there is any tumor, brain tumor or a neurofibroma kind of things, then this treatment is an option. Third treatment usually they say is a ketogenic diet. And vagus nerve stimulation. These are 4 main strategies or treatment options in a modern medical practice. again, one more reason for us to start this education programs or awareness programs is because in a hurry to try alternative medical systems, people usually tend to neglect medicines. So I kindly request all the patients not to stop any medications as such unless under medical guidance. So don't stop any medicines on your own. So this is a kind request for all of you. Anti-epileptic medications. So most commonly, and in a modern medical world, more than 70 to 80% of people will get benefit just by taking regular medications. About ketogenic diet and vagus nerve stimulation, we study in detail during the workshop time. Next we go ahead and see a few complications in epileptic patients. During the attack, the person may have a sudden fall from some particular place of work or walk or whatever the person is doing in a routine life during an epileptic attacks. Patient may fall and injure himself. If the person is swimming, so he can get drowned if there is the loss of unconsciousness or if there is a tonic-clonic seizure. Patient can get drowned. So these complications are important because the person who is nearby can help maximum during the epileptic attacks to the patients. So that we'll study in next option, where we'll find out what are all the first aid measurements which you need to do in an epileptic attacks. You'll know that. If the person is driving or if he is working in a factory where there are dangerous instruments, patient may end up in some accidents or very serious injuries. If the person is a lady with a pregnancy having epilepsy, they may end up in some abnormal uterine contractions or abortions or bleeding per vaginum, all other symptoms which are related to pregnancy complication, because a continuous uncontrolled electrical activity from the brain will also contract and stimulate and work more on uterus. So where if it is a near pregnancy or it's a 7 months of pregnancy, it may end up in premature delivery because there is abnormal contraction of uterus. So there are few pregnancy related complications which we will study in detail during the workshops if there is any pregnancy patient with epilepsy. Other emotional issues will be the major significant problems which most of the modern medical doctors tend to avoid or tend to neglect because it's just related with the psychology or it's related with the mind of the patient. So that issue we need to concentrate more, because a guilt feeling as if I'm having a disease, it might be due to my past life karmas or some sin or demonic possessions, something like this people may think, and they end up in some form of depressions or isolated feelings and some other emotional issues like a depression. Last two complications are very serious complications. We call it as a status epilepticus. Status epilepticus means epileptic attacks are so profound that it is continuous epileptic attacks where there is a tonic-clonic seizure. Patient may end up in breathing difficulty, inability to breathe. Once the breathing has stopped or paused, there is other complications like a decreased oxygen saturation for the brain and other related ischemic complications of the brain. Or patient may end up in death because of respiratory failure or lack of oxygen to the brain. So that is few details about status epilepticus. Remaining details you can find out, or you can consult in person to know about this, or you can Google it out to find out more details of status epilepticus. One treatment option for status epilepticus is general anesthesia. epileptic attacks are so profound that a general anesthesia can solve or cure this particular status epilepticus. There is one rare form called as sudden unexplained death in epilepsy. We say SUDEP.
Okay.
This is an important aspect of patient awareness about first aid during epileptic attacks. If the person is having epilepsy attacks in front of you, what you need to do? So those are few ideas which I am going to share with you. First of all, don't become panic and run around here and there. Be very calm and reassure people, surrounding people. Say that this is an epileptic attack and patient will recover. So don't create any panic whatsoever it is. Be calm and reassure the people around you that it is not going to harm him. It's not life threatening. Let that particular epileptic attack continues for about few seconds. So reassurance and maintaining the calmness is at most important in a public place where the person is having an epileptic attacks. The person who is having epilepsy attacks may or may not be aware of his or her epileptic attacks. So, but this first aid practice is for other people, maybe family members or the people surrounding the epileptic person. Keep the person safe until his symptoms of epilepsy stops. Say for example, a patient is about to fall or something like that. You make the person lie down in a flat surface with some pillow underneath of his head. If there is anything in the person's mouth, you can just take it out and you can help the person in breathing properly. So keeping the person safe is at most important. Third thing is preventing injury. Again, these two precautions are symptomatic together. We need to exercise these two together. Prevent injury. If the person is having epileptic attacks, take out the sharp objects around the person. Take out the hard surface area, maybe like a stone and other hard things or stuff which can cause injury to this epileptic patient. We should avoid and take out or remove those sharp and hard objects. Ease the patient. Make the patient comfortable, lie down on a flat surface with a soft pillow underneath of the person's head. So you can help the person. If the person is having a sunglass or a spectacles or a tight cloth around the neck, you can release or ease the patient so that the patient's breathing is proper. Few things you need to take care is that don't try to hold the fits attacks or epileptic attacks and don't try to stop the convulsions. Kindly don't try, never ever try to control or stop the convulsions by yourselves until the convulsion stops by itself. So don't put anything in the patient's mouth. So few people, they have a superstitious belief that putting some iron or some leather in person's mouth can stop the epileptic attacks. It's not right. So kindly don't put anything in the person's mouth because the person needs to breathe properly. So if you put something in the mouth, it can go and get stuck in the respiratory system of the person and you can create much more complications than just simple epileptic attacks itself. So these few things you need to take care. One more important thing is don't start any artificial respiration unless the person has already stopped breathing and that breathing has stopped for more than 5 minutes. Don't ever try to exercise artificial respirations during the convulsions. So notice the breathing of the patient. So these few things you need to take precautions. These are all the first aid during epileptic attacks. And when you need to call the doctor is if the epilepsy attacks is a recurrent, one after another attacks are happening. If the patient has stopped breathing, if there is a tongue bite or if there is a bleeding or if there is any injury to the person, then you can call police and the ambulance immediately for further institutional medical help. When I say institutional medical help, it means the patient has to be shifted to the hospital immediately where the neurologist or a internal medicine doctor will see the patient and then do the necessary treatments for saving the patient. So these are very few first aid exercises need to be practiced during epileptic attacks to the patient. Now we'll go ahead and see what are the roles and responsibilities of a person suffering from epilepsy. So I kindly request all the people who are having one or other forms of epilepsy to take medicines regularly as advised by your doctor. So please take medicines regularly. Consult with your neurologist or internal medicine doctor as and when required. Say for example, your doctor will say, come every month. After 1 month of medicine, please come and visit. Please visit your doctor whenever the doctor said. Maybe 1 month, 3 months or 6 months. Keep on visiting the doctor and get the necessary blood tests, X-rays, CT scan or MRI required or suggested by doctors on time. So have a very good sleep. So this very good sleep can reduce the triggers of the brain. If you are exhausting yourself too much, that can induce seizure frequency. So we say that sleep well and don't take much stress. We advise that thing. Also advise not to smoke, not to take any alcohol, not to take any drugs or any harmful substances, because epilepsy can get triggered or increases by practices like smoking. Excessive smoking and alcoholism can increase the epileptic seizure frequency. Avoid circumstances which can harm you, like circumstances like driving or working in a factory with lot of machines. Those circumstances you need to avoid. And patients can have a medical information bracelet, an emergency bracelet where the information about you has been mentioned on the bracelet and it's there in your hand. If you fall suddenly with some epileptic attacks, other people who are surrounding, they will see your bracelet, medical bracelet information, and they'll say that okay, this person is having epilepsy attack and he is a patient of epilepsy. So the treatment option will be fast, that in the way to reduce the epileptic seizure frequency and hospital treatment. So bracelet is necessary for people with severe grade of epilepsy and frequent attacks of epilepsy. So last but not least, we say exercise regularly, reduce your fat, modify your lifestyle, and most of the time try to be stress free or adopt techniques or coping up mechanisms for stress reductions. So you need to be relaxed most of the time. This concept we adopt, last concept of lifestyle modification and relaxation, to an extent that we cover overall physical, emotional, mental, vital, intellectual and bliss levels of each personality, including the personality of himself and with the surrounding family, society and the community at large. So this one you need to practice with utmost care. And few other things, like there are so many questions epileptic patients will ask. How many years I have to take medicines? It all depends on which kind of disease you are having, and you need to consult your neurologist before consulting any other practitioners. Now coming to the important aspect of lifestyle modification and relaxation, we adopt integrated practice of combining yoga therapy along with exercise patterns. We say yoga therapy an integrated exercise for people with epilepsy. Our main focus is mainly on the breathing practices, pranayama, and the body's relaxation response and effective stress management. These three key features holds very good for any people with epilepsy. Effective breathing, relaxation response and stress management, and also with few exercise patterns and diet modification which will help the person to manage his or her disease effectively. What diagram we are seeing here on this side of the board is a yogic concept of therapy. In ancient scriptures like Yoga Vasishta, there is a mentioning that each individual have 5 different layers of existence. We say physical body, vital body, emotional body, intellectual body and your bliss body. So all the things which you are learning now is for your intellectual body to understand what is the disease, and then work on your emotional body, and then work on the physical body and your vital energies, so that you can effectively manage or reduce or control or cure in some cases this epilepsy attacks, along with modern medical medicines and other practices as advised by the neurologists or internal medical doctors. So at a physical body, what we give for these epileptic patients are very few, very gentle asanas which are exclusively designed for each and every individual of different patterns or different forms of epilepsy. So it is, again, I cannot just say this asana you use for epilepsy. No, it is all subjective. It depends on the person who is having that particular type of epilepsy and how frequently the person suffers and what he or she needs to do during the seizure free or epilepsy free attacks time. So I advise them to have 2 diaries they need to maintain. One is on seizure diary. They need to record or maintain how many times of attacks they had in 1 month. They need to maintain a diary. If the person is having loss of consciousness during the epileptic attacks, he or she may not able to remember what attacks he had, so he can request the parents or family members to record how frequently he or she had those epileptic attacks, and during the attacks how many jerks or what other symptoms the person had, like rolling of eyeballs upwards or biting the tongue or froth coming out of the mouth or clenching of the hands or jerky movements of the hands or urination or defecations. All the symptoms need to be recorded in a diary, separate diary, so that it will be very useful for a doctor to come to a conclusion and adjust the dosage of medicines according to your symptoms of epilepsy. So I request them to maintain a seizure diary and a stress diary. Stress diary is very important because it's a part of yoga therapy concept, where stress, if not, it may not cause you epilepsy, but it increases the seizure frequency. It increases the epilepsy attack rates in a person. So that's why we say sleep well, be stress free, be guilt free, be free of depression, eat on time. We say this because we want the person to be healthy and stress free. So the stress can induce increased seizure rates or frequencies. Number of seizures may increase in a 1 month if the particular person is having more stress. So the seizure frequency may increase. If somebody is having 1 epilepsy attacks per month, if he or she is stressed, the seizure frequency can increase. So you need to maintain these 2 diaries. Now we are starting a practical aspect of integrated medical yoga therapy for epilepsy. So as I said, these treatments are mainly based on a therapies which are dependent on each individual. So for each individual, the different ingredients of this particular therapy varies. So I say it's subjective treatment. But on a broader sense, we categorize the exercise programs mainly on these 5 concepts or elements. First is breath and body awareness exercises. So we say we make the person of epilepsy realize that what is the importance of breathing in coordination with his or her hand movements. So say for example, we say hand stretch breathing. So I am just demonstrating one small exercise of breath and body coordination. See how you make the person coordinate his or her breath and body in a such a way that he or she can reduce the seizure frequency and stress frequency in an effective way. There is a research which shows that if the person is having less stress, so the person will have less seizures. So this is a research which says, I will show a simple example of hand stretch breathing. This is hand stretch breathing. I am interlocking my hands, keeping on my chest. I am taking my breath in and I am stretching my hands out. Exhale. Again inhale. I demonstrate these practices during teaching because all these therapy exercise programs are very gentle, very simple, not with very hurry or not with excessive breath usage. You need to be at most careful when you are dealing with any patient suffering from epilepsy. So there are types of breath and body awareness exercises. Say for example, there are more than 12 exercises for coordinating your body and breath movements and breath awareness. There are few groups of exercise which I am going to demonstrate to you now, which are mainly to increase the awareness, increase the relaxation and reduce the stress response. And there are few mudras also. Third one is the breathing practice. So gentle breathing practice like a Nadi Shuddhi, Nadi Shodhana Pranayama or a sectional breathing you can practice, or you can give these 2 practices in any person with epilepsy after consulting medical doctors. So in our case, being a doctor and a yoga master, we ourselves evaluate the patients. When the patient comes to us, we evaluate the patient and then we start the exercise modules, which is again I say subjective. So it depends how many years the person is having epilepsy and which kind of medicines the person is taking and how long the person is taking, what is the age of the patients, what is the dietary habits, what is the lifestyle habits of the patient, and then we modulate or design the exercise programs based on each individual separately. It is not like an epilepsy CD, you take it and you can practice. So it's not exactly that, but it's again subjective. But whatever practices you are learning online now is mainly for your awareness. So even in this, I advise you to take your medical suggestions before practicing any of these practices advised. We use the resonance of Omkara to generate a relaxation response in the person so that he or she can reduce the stress response. There are a few practices like deep relaxation technique and sankalpa or auto-suggestions during the technique where you feed your subconscious mind with few of the intelligently added auto-suggestions or sankalpas in a such a way that your subconsciousness or your subconscious mind will take this suggestion as an order and then it will work on these particular auto-suggestions when you do it practice frequently. There are few yoga mudras which need to be practiced. Yoga mudras are nothing but to re-channelize the subtle energies of you. So those subtle energies may be in the form of vital energy, or maybe in the form of nerve reinforcement or facilitations of nerve conductions. All these integrated practices will help. So we see you in person in our workshops for this exclusive exercise programs. For each individual it will be different. So with this we end our lecture programs or educational programs for epilepsy at this moment. And you see few of the exercise practices which we are going to demonstrate now. Anybody with any form of epilepsy can practice this exercise forms with one or two medical consultations. Either you can consult your own doctor or you can come and consult us, and then you can start practice. But for you to see which kind of exercises are there, we are going to demonstrate very few exercise forms now. Few exercise modules which we have designed for a person with clonic tonic seizures, coming seizures every 3 to 4 months, maybe 1 or 2 times in every 3 or 4 months. The person is on medications and his symptoms are mainly unknown. Cause of epilepsy is not known. So these practices we have designed for them. This information is again a video information for the patients to be aware of the practices what they are doing. It is not a replacement of any medical therapies as such, but it is an add-on treatment along with medicine practices. So I advise all the people to see this video, but before you practice, please take consultation from your respective medical doctor. I show you some demonstration of breath and body awareness. Interlocking your hands. When I take breath in, I stretch my hands outside like this, making an angle of 90 degrees with the body. And when I exhale, I bring my hands back and relax. Like this. Inhale. Stretch your hands to make an angle of 90 degrees. Exhale, bring it back. Inhale, stretch. Exhale, bring it back. Inhale, stretch. Exhale, bring it back. Like this, there are 3 modifications. One at the angle of 90 degree. One you can practice at an angle of 145 degree. One you can practice at an angle of 180 degree. It's like this. I'll show you one each. Inhale, stretch to an angle of 90 degree. Again exhale, bring your hands back and elbows back to normal. Like this you can practice 10 rounds. Then again next rounds you can practice making an angle of 145 degree, which will be just above your forehead, and bring your hands back. So this is one round. Like this you can do 10 rounds of each practice. So the third one is 180 degree, making an angle of 180 degree like this, and bring your hands back. Relax. Like this there are more than 16 exercise patterns where we combine breathing and body awareness. One may be like this. I'll show. Both hands in front. Inhale, expand your hands. Exhale, bring it back. Inhale, expand your hands. Exhale, bring it back. Like this we practice for 10 counts. Few mudras for nerve reinforcement and facilitation in epilepsy people. We call this as a Ganapati mudra or Ganesha mudra. Holding your hands like this, either on one side and interlocking with other hand like this, and pulling it together in front of your chest and holding for about 10 minutes. This will help you to facilitate the nerves, increase the conduction, improve the conduction, and equalize or balance the electrical activities. It helps in a very indirect way, cannot be direct. This we call it as a Ganapa Mudra, Ganesha Mudra. Slowly, gently, from the practice. Pause. There are very few exercise forms I have shown you, which are breath and body awareness practices. All other remaining practices you can see on www.Chana Yoga Online. You can see the full video form, maybe for 40 minutes of complete video on exercise for epilepsy. Few practices like Brahmari, like this. I am putting my thumb onto the tragus and closing the ears. Second, onto the forehead. Middle finger on eyes gently. Ring finger near to the nose and little finger near to your mouth, angle of your mouth. Then making a sound like a bee, like this. One thing you notice that you are practicing these subtle practices mainly to focus on your disease part and also health. So don't be in a hurry to practice, or don't overdo all these practices. So do it very gently with more relaxation in between each practices. Now I will teach you Nadi Shuddhi. Nadi Shuddhi means it is nostril breathing, where we regulate our breath in such a way that both the nostrils, if we see the person's nostril, one side of the nostril will be dominant each hour. So every hour, every 1 hour, the nostril dominance changes. So by practicing Nadi Shuddhi Pranayama, you can balance your breath in such a way that both the nadis will be active simultaneously and constantly. So this is a mudra called as Nasika Mudra. Turn towards your face. You can close your right nostril. Exhale from your left nostril. Exhale. Inhale. Close your left nostril. Exhale from the right. Inhale from the right. Close the right. Exhale from the left. This is a one round of Nadi Shodhana Pranayama. So like this you need to practice at least 15 to 20 rounds of Nadi Shodhana Pranayama in a very gentle and simple way. All rest of the programs you will be seeing on www.Chana Yoga Online. Thank you very much. Thank you one and all.